Has your dog slowed down or stopped enjoying walks? Is your dog hesitating to climb stairs or jump into the car? Does your dog limp after exercise or after resting? Is your dog reluctant to stand up or takes longer to rise? Does your dog stretch more often or lick or chew a specific limb? Have you noticed muscle loss, thinner thigh, on one leg? Does your dog sleep more or seem less interested in play? Is your dog cranky, reactive, or snapping when touched in a certain area? Do you notice stiffness in the morning that improves with movement? Has your dog gained weight or become less active recently? If you answered yes to any of these, you're not overreacting. You're right to be concerned. I'm Dr. Jonathan. Today we're talking about one of the most common causes of pain and mobility loss I see in practice, arthritis and joint problems in dogs, specifically osteoarthritis and hip dysplasia. I'll walk you through the signs to watch for, what causes it, how we diagnose it, the tests we use, safe home treatments, medications your vet may prescribe, and when surgery or advanced therapies are considered. Let's get started. You're at the right clinic. We'll do a thorough exam and build a plan tailored to your dog's stage of joint disease and lifestyle. What is arthritis? Osteoarthritis is a chronic, progressive disease where joint cartilage breaks down, joint surfaces change, and inflammation causes pain and reduced function. Hip dysplasia is a developmental condition of the hip joint that creates abnormal laxity and wear, which often leads to osteoarthritis later in life. Causes are multifactorial. Genetics, conformation, large breeds more prone to hip dysplasia, previous injuries, fractures, ligament tears, obesity, and abnormal joint development. Early detection helps us slow progression and reduce pain. Now we explain its signs. Common signs are subtle at first: stiffness after rest, decreased activity, limping, difficulty rising, reluctance to jump, muscle wasting, behavior changes, irritability, and sometimes visible joint swelling or crepitus, a grinding feel. Dogs often hide pain. That's why the owner's checklist is so important. Causes and risk factors. Key risk factors are breed and genetics, large breeds more prone to hip dysplasia, obesity, extra stress on joints, previous trauma, certain growth rates in puppies, and age. Preventive breeding programs, OFA or pen hip, lower risk, and early weight management, lower risk. Diagnosis and tests. Diagnosis begins with a careful history and a physical orthopedic exam, watching gait, palpating the joints, checking range of motion, and assessing muscle mass. Common tests we use are orthopedic exam and gait assessment, watching the dog walk or trot, radiographs or x-rays, standard tool for osteoarthritis and to evaluate hip conformation, OFA-style views. Pen hip, distraction index, measures hip laxity and can be done in younger dogs to assess risk. Arthroscopy, joint tap, sometimes used to rule out infection or inflammatory disease. Advanced imaging, CT or MRI, for complex cases or surgical planning. Functional scoring, owner questionnaires, and objective tools to track pain over time. Remember, radiographs may not show early cartilage damage, so we combine owner observations, exam findings, and imaging. Home care is hugely important and often the first step. Weight control, the single most effective measure to reduce joint load. Aim for ideal body condition. Controlled, low-impact exercise, short, frequent walks, underwater treadmill or hydrotherapy if available. Avoid high-impact jumping. Physical rehabilitation or physiotherapy, targeted exercises, massage, laser therapy, therapeutic ultrasound, comfort measures, orthopedic beds, non-slip rugs, ramps or steps for cars and furniture, nutrition and supplements, balanced diet. Evidence supports some nutraceuticals like omega-3 fatty acids and certain chondroprotectants as adjuncts. Discuss with your vet. Environmental modifications. Keep food and water accessible, prevent slippery floors, and maintain warm resting areas. Medications and clinical treatments. Medication should always be guided by a veterinary exam and diagnostics. Common options include NSAIDs, nonsteroidal anti-inflammatory drugs, mainstay for pain control. Examples commonly used by vets are carprofen, meloxicam, or daracoxib. These reduce inflammation and pain, but must be used under veterinary supervision with baseline blood work and periodic monitoring. Adjunct analgesics, gabapentin for neuropathic pain, amantadine for chronic pain or pain modulation, low-dose opioids short-term in some cases. Each has indications and side effects to discuss. Joint injections and disease-modifying agents, polysulfated glycosaminoglycan or Adequan, hyaluronic acid injections, or platelet-rich plasma, or PRP, or stem cell therapies in specialized centers. These are considered when long-term management is needed or to reduce NSAID reliance. Surgery. For developmental conditions like severe hip dysplasia, options include juvenile pubic symphysiosis in young dogs, femoral head osteotomy or FHO, or total hip replacement or THR, depending on age, severity, and goals. Importantly, do not give human NSAIDs to your dog. They can be toxic. Always get a prescription and monitoring plan from your veterinarian. Watch for subtle changes in activity and movement, control weight, get a proper exam and radiographs if you're suspicious, and use a multimodal treatment plan. Early action makes a big difference. If you found this helpful, please like, share, and subscribe to the channel for more vet tips. If your dog shows any of the signs we talked about, book an appointment. Early treatment preserves mobility and comfort. Thanks for watching. Until next time, take care of your furry family.